Welcome back to another video in which we are going to talk about what the chest in a newborn looks like. Now, the chest wall in a small baby is thin because the muscles around the chest wall are not that well developed. As a consequence, what happens is that the upper part of the chest tends to move with every heartbeat. So every time the heart beats, the chest wall goes up and down, up and down. Now, the heart rate in a small baby is almost about 140 beats per minute. That is a lot of beats. And therefore, I often find young anxious parents bringing their newborns to the clinic, worried about how rapidly the chest wall moves in a small baby. This is normal. And the heart rate tends to decrease with age as the baby grows up. The breathing pattern in a small baby is very variable. It can vary anywhere from 40 breaths per minute to about 60 per minute. Anytime the baby is active, crying, laughing, moving a lot, the respiratory rate tends to go up. During sleep, the rate can be anywhere between 20 to 40 breaths per minute. Now, there's something else which is called the periodic breathing in small babies. The breathing pattern, to begin with, is fast and deep, alternating with shallow and slow. And then there's a cessation of breathing for a few seconds. So very often I find young mothers coming to the clinic very worried that my baby's breathing pattern was irregular and that the baby stopped to breathe during sleep. This is normal. A lot of parents are concerned because they think that this irregular breathing pattern can be linked to sudden infant death syndrome or the crib deaths. Now, crib deaths or SIDS happens mainly in an absolutely normal, healthy baby without any illnesses. It is most common between 2 to 4 months of age and happens more in boys than in girls. There are certain risk factors involved with SIDS. Number one, smoking by the mother when she was pregnant. Number two, poor prenatal care, prematurity, very young mothers, less than 20 years of age, secondhand passive smoke in the house, and by far the most important risk factor is to lay the baby on the tummy when the baby is sleeping. So it's highly recommended that small baby should not be allowed to sleep on their tummies. They should be sleeping on their backs or on their sides. Because sleeping on the tummy seems to be the single most important factor which is linked with SIDS. Apart from this, sometimes in small babies, you can get swollen breasts in both the boys and the girls. And sometimes there may even be slight milky discharge coming from the nipple of the babies. This is absolutely normal. This is because of the hormone estrogen that has been passed from the mother to the baby prior to birth. And this will usually take a few weeks to settle down. Please do not press the breast tissue in order to extract the secretions. Leave it alone, keep it nice and clean and dry, and let it sort of subside on its own. However, if a breast area in a small baby appears very red, very inflamed, swollen, painful, and the baby is in a lot of discomfort and crying, then you have to go to the doctor to get it checked out to rule out any kind of infection around the breast tissue. So this was by and large about the chest. In the next video, we are going to talk about the abdomen. Thank you for watching this video, and I shall see you soon.